Virtually everything is broken in our healthcare system. The one thing that's still good are the people. We still have very good healthcare workers, which is why we have the massive brain drain.
We're losing a lot of doctors, we're losing a lot of nurses, a lot of healthcare practitioners in general. And you wonder, why do they need to leave the country to another country? And it's just because the system here is broken and it's not providing what they need to make them stay here.
Healthcare is expensive. I think it's expensive everywhere. But I think what makes it trickier here is everything we use to provide care besides the people is imported. So the cost of providing healthcare is extremely high and it's tied to the exchange rate. And then the usual issues that you would deal with running a business in Nigeria, power, clean water. So all those things are working against us.
The healthcare system needs a lot of revamping. It needs to do a lot. At the end of the day, we keep saying the government, but also we need to also look inwards, talk to each other. Why do we need to go somewhere else to make their system better when we can make our own system better here?
Patricia was born with something called the Charge syndrome. She was my third child. She was born in 1994, the 25th of May, 1994. And she was born with about 6 or 7 abnormalities. So on her third day of life, I had to take her with me to the UK for life-saving surgery. She had to battle with a hearing defect. She had to battle with difficulty with eating. And so she had 5 surgeries in her life, some cosmetic, but more life-saving and quality of life improving. So she received healthcare in 3 countries, across 2 continents. And so when I started this practice, I wanted to correct the things that I thought were defective here. So I must say that she died as a complication of the one surgery she did in Nigeria. People make up the team of Paleon, and Paleon is a hospital where we provide healthcare, everything in one place, and where we do it with passion.
It used to be a smaller setting back in the days. It used to be the clinic. Now it's a full-time hospital. Now we're attending to primary, secondary, and tertiary care.
Then it was mostly known as a pediatric hospital. But as time went on, we had different specialists come in, and then our care given to patients just increased.
So I realized that the only way I could scale my business was to fund it. It's very difficult to access finance in Nigeria, extremely difficult. So for the first 2 years, I will go to work in other hospitals to earn money, to pay salaries in my practice. So it was very tough. But by God's grace, I stayed the course. And then suddenly the pandemic in 2020, and that was what changed the story of the hospital.
We're going to begin here with the outbreak of a mystery virus in China that now has the World Health Organization on edge. At least 4 people have died and hundreds more are sick, though there are concerns 5 times as many people could be infected. Tonight, Chinese health officials say the illness, which is a new strain of coronavirus, can be passed from person to person, stoking fears that it could be moving faster than it can be contained.
A lot of healthcare workers were cowering away from the pandemic and, decided firmly that they will not treat COVID. But I called my team, so we stood right out there, and I said to them, we don't have a choice. We will treat every patient who comes here. And I reminded them we all swore professional oaths. And I said there's no part of a professional oath that says you will treat one illness and not another. So we will treat everybody who comes through this door.
The first 2 weeks, we didn't go home. Everyone was scared. If they knew what to expect, I'm sure they would have sent out people. But with the stay at home, lockdown and everything, everybody needed to get used to what was happening.
It was not easy. There was a lot of pushbacks. There was a lot of people saying, no, you shouldn't do it. Don't go for it. It's dangerous. Anything can happen. But we still pushed ahead. We still forged on, saying we must make a change and we must help people, because there were a lot of people that came and didn't have anybody to help them. And we were able to.
Luckily, Paleon, they pride themselves with standard. So going into the field, they had provided everything we needed. There was no compromise on quality. We had protective devices and everything. So if it was in terms of being scared or being infected, no.
I said, the only thing I'll promise you is that I will do everything in my power to protect you. And I will lead you from the front.
I admire Dr. Ngozi Onyia for the strength, because she came up and she said, we can do this, and we did.
So when your boss is someone who would not shy away from responsibility, you won't shy away. I've stayed quite long to know that if she wanted you to do something, she would get it done herself first, and then everyone would follow. It felt like you had the responsibility of these lives coming in and making sure they go home safe. When they got better and you see their family rejoicing to go home, it gave the satisfaction that we did something right.
And then the 24th of March, I got a phone call that they were going to refer a patient to us who required ventilation. The son of the woman on the ventilator had seen the notice I put out saying we were shutting down the Ikeja branch. And he had to look after his mother at home for 13 days, because as soon as the diagnosis of COVID was made, nobody was willing to admit her. So he had looked after her, had only brought her into hospital when she required ventilation. So he said to me, why are you shutting your Ikeja branch? Why don't you convert it to a treatment center for COVID? And he said, I will help you, because he realized we were struggling financially here. But I didn't want there to be an exchange of money, because I think the major thing I pride myself on is my reputation and my integrity. I didn't want anybody to say we gave her money, so I said, we will give you a list of equipment we require. And then I remember that a couple of companies had approached me previously also at the beginning of the pandemic to say, if we have patients who require ventilation, will you be willing to take them in? And one of them had actually offered to buy me more equipment, but we didn't have the space in this building. So between the Ganglani family and IHS Towers, they equipped the Ikeja Hospital, and we started the COVID treatment center, for which we became very well known. And I think we treated more COVID patients than any other private facility in Nigeria at the beginning. So for the first 9 years, we struggled. We ran the business basically on sweat, blood, and tears. We were inadequately capitalized. But with the COVID pandemic and treating COVID, for the first time, we capitalized the business properly.
She has a heart, for people, a heart for God. And she's been able to put that together in her medical practice to the end that she's not all about the money. She wants to create solutions first.
In business, it's payment before service. In healthcare, it's different. And in Nigeria, some hospitals have tried to insist that you pay before they start taking care of you, but the conscience of Paleon just can't take that.
The vision of the hospital is to redefine healthcare in Nigeria. And I think to an extent we are considered the benchmark, as small as we are.
They know us for integrity, and they know us for getting it right the first time always. So we make sure that it is evidence-based. Everything is to the books. Okay, what is wrong with you? We will check, and it will be there it can be verified from any part of the world.
It's not a question of what I think or what I've done in the past, but what does the evidence show is the best way. I think that's the most important thing we do. Then we're very big on patient safety. So we have all kinds of equipment to ensure patient safety, like infusion pumps, patient monitors. So we don't leave things to chance. Everything that we require to provide to make healthcare safer, we try to make it a very happy workspace, and it is a happy workspace. So a lot of hospitals are struggling with the high turnover of staff. We don't struggle that much, and they don't leave us high and dry. Not just doctors, all healthcare workers, they don't leave us high and dry. We also have more processes than other hospitals do. So we are run much more professionally. and other hospitals, we have a governing board from the beginning. We pay better than average. We provide a lot of support for them, loans to pay their house rent and things like that. So we provide a lot of support. And then when the hospital prospers, and I think I must say this, we pay out bonuses.
One of the things we're known for is being all female. There's a lot of strong, capable, competent women in the organization, and we support each other. And life is difficult, enough on its own, just being in Nigeria and being a working mom, it can be a complete nightmare. And so one of the things that we do here deliberately is we support each other. So we get work done and still are able to live our lives as moms, as wives, and whatever else it is that we're doing.
We look out for each other. We make sure that everybody does good and is doing right or is doing well. We have like a family-oriented kind of setting here, making sure that we are doing our best and giving the best to our clients. Excellence,
we say, honors God and just impacts people. Yeah, it strikes a chord with people, and it makes them open up their heart towards you, and gives us a fantastic opportunity to be able to reach them. And I think that's what she's been able to do well.
Excellence is scarce in Nigeria, and I serve an excellent God, and I have an excellent leader in the Lord Jesus Christ. And so I'm just trying to be like my father. My work is beyond a job. It's my mission in life. And so I believe this is my calling, it's a vocation. And so this is my life.